Hi everybody, my name is Bafuma. I'm a physician assistant in Hudson Valley, New York, and I want to talk to you today about some emergency medicine and infectious disease pearls. I tweet at EM in focus, is what that's supposed to be. You can reach my email address at any time, and all the slides from today's show, as well as the handout and a lot of the papers that we'll be talking about will be found at this hyperlink, and this will open up a Google Drive for you. So, as I'm sure many of you are aware, the conference organizers hit the social media scene pretty hard this year. They had the social media workshop yesterday, and so what they actually wanted me to do is to make this a little bit more millennial friendly. And so, being the millennial I am, I started with an Instagram poll. So, based on a couple of cases that we're going to go through, you're going to vote WTF or yes. Peter, that's millennial for yes. This is your next patient that you see in the emergency department or upstairs on the floors. The question for you is, in addition to antibiotics, are you giving this person steroids for orbital cellulitis? How many of you are voting WTF?
Let me know.
No. How many of you vote no for steroids for this patient, in addition to antibiotics? How many of you would vote yes? All right. So the answer to this, there's quite a few studies on this. Now, they're small studies. Orbital cellulitis doesn't come around often. However, the studies on this are very consistent. People get better much, much faster with doses of steroids, in addition to their antibiotics. They have better vision. They have better long-term outcomes. They have better extraocular movements with the dose of steroids. And in fact, you use less antibiotics. Patients stay in the hospital a lot less when you provide steroids with your cellulitis in this setting. So the answer is yes. Next case that comes through. Big, angry leg. Clearly a cellulitis, you know it's not a DVT. Peter ran over and ultrasounded them in triage and told you as much. Same question. Steroids for this patient. WTF or yes? How many of you would vote no steroids for this patient? How many of you would give this patient some steroids? The answer again is yes. Steroids for cellulitis. Same thing. People get better much faster. Decreased length of stays. Less antibiotic usage. And if you're a little gun shy about giving a dose of Decadron to these patients, you can give them around-the-clock NSAIDs. Not PRN NSAIDs, but like 400 milligrams of ibuprofen 3 to 4 times a day. And the data behind that, about 80% of patients will have significant resolution of symptoms with the NSAIDs at the 48-hour mark, versus less than 20% if you do not provide the NSAIDs. I'm sure we've all had the patient that has come back in a day or two and said, my cellulitis isn't getting better. And so what do? People give them a dose of IV antibiotics. Sometimes they end up getting admitted, or they get OBS, or you change the antibiotics. When in reality, they just needed more time. Or they just needed a dose of steroids at time of presentation. So the answer to this one is that you're probably doing this more often than you think. How many of you are giving a dose of steroids to your peritonsillar abscesses? See? This is an infection in someone's airway. Right? So this is probably a more high-risk case than the last two that we talked about. And you're already doing it. And you should know if you've done this for more than a couple of patients with peritonsillar abscesses, you know that they get better within an hour or two. They feel much better. It's been shown with peritonsillar abscesses, if you give them a dose of steroids, that they oftentimes may not necessarily stay in the hospital. They get instrumented less. They get better faster. You're already doing this. I'm just asking you to take the next step to apply it to a different patient population. Anecdotally, I've been doing this for 3 years. They are awesome. That patient that you have with the facial cellulitis that you're adamant has an abscess inside their mouth, you scan their face, inevitably none of them I've ever seen have had a dental abscess that has needed to get drained. I've gone from admitting all of them with that big nasty face to obsing them and giving them a dose of steroids and obs, to almost exclusively discharging them after getting them a dose of Decadron in the emergency department. This works. That big buttocks that is red and inflamed on one side, and maybe the patient has a low-grade fever, same thing. Dose of much faster. And the IDSA backs you on this. This is verbatim the IDSA guideline for cellulitis. And so, maybe you're a little concerned. Maybe you're a little concerned about getting yelled at. That's okay. Here's how you document this. Due to the extent of the erythema and the fact that steroids have been shown to hasten resolution of symptoms, and that their usage has been endorsed by the IDSA, I've chosen to give this patient a dose of steroids. If you still get yelled at, then you can do what I've done and drop the IDSA guidelines on your boss's desk. Now, tip number 1, use steroids for your cellulitis and your abscesses. Patients do get better faster. Now, this next one came as a surprise to me. This is a risk factor that, when present, people get sick more frequently,